Hi everyone, I'm Dr. Vikram Jayaprakash.
And I'm Dr. Russell Knudsen.
And in today's episode, we're going to talk about a common medication that's used by a lot of young men out there, and that's Roaccutane, and it's used for individuals that are suffering from acne. We use it for a lot of things by dermatologists, but it's very commonly used for acne and the implications on hair loss. So stick around and we'll have a chat about that.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
So, acne in teenagers is very, very common. The androgens that are secreted, testosterone and the related androgens at puberty, increase the activity of the oil glands in the skin. The oil glands sit on the side of the hair follicle, as it turns out. And so there are many, many young women and men who suffer from teenage acne, which can be quite disfiguring. And one of the most effective medical treatments that has been used, particularly in the last 10 years, is a medicine called Roaccutane, which modifies the way the oil is secreted. And so if used over a period of time, it changes the way the oil glands work. It reduces the thickness of the oil, which means that you get less blocking of the glands and therefore less acne. And typically, patients who are put on it, we put on it for a period of maybe 18 months on a full course before they may then sort of bring the dosage down. And so if people are still getting a little bit of prolonged acne in later life, they might have 1 or 2 doses a week instead of 7 like they would be prescribed at the start. And one of the recognised side effects in the literature of using Roaccutane is called hair loss, but what they really mean is hair shedding. All right, so it's not that it's damaging in the sense that it's causing permanent hair loss, but if you increase shedding in a young person who is genetically susceptible to balding, then it can act as an accelerant of the process of initiating balding, because typically in balding, what's happening is a healthy hair falls out and starts to be replaced by weaker hair as it goes along. And if you're accelerating that process, then you're accelerating the thinning. And so we often get our young patients coming in on Roaccutane with early worry about loss of hair, and then we have to give them some advice.
Yes, and it's a tricky balance to have, because you've got quite commonly individuals, and if they're young men in their sort of mid to late teenage years, who are worried about this acne, who have started worried about their appearance and started on Roaccutane. If they experience hair, they're obviously, because they're worried about their appearance, worried about their hair. So it can be quite an emotionally fraught sort of period of their life, especially with hormonal changes and everything going on as well. So it's about trying to guide each individual through that period and go, give reassurance, but also know when to act and when to sort of intervene and look at what else can we add into the mix to try and assist this individual.
So normally the way I deal with this is that I never ask them to stop Roaccutane.
Correct.
Because to me, the cost-benefit analysis of that is that the acne is the thing that we need to make sure that they can be on long enough to control, because it changes the way the body works with the oil glands. And it's not that they have to stay on that dose forever, but if they stay on that dose for a period of time until the body readjusts, then that's fine. So I want them to stay on the Roaccutane, but I obviously don't want them to aggravate hair loss, particularly in a family with male pattern balding and significant balding. So if they are old enough, in my opinion, to use something like finasteride, then that's what I will recommend, because what I really want is to reduce the amount of DHT in the system, which, by the way, if you reduce the amount of DHT in their skin, that's helpful to their acne, because DHT is the more powerful stimulant of the oil gland. So it's a supportive measure if you think about it that way. So what I like to do in those patients, and they'll often come in with a parent, which is very appropriate, and I'll say to them, look, the Roaccutane is clearly an important part of what we need to do at the moment. But what we're trying to do is to prevent excessive amount of hair loss. So we'll put a bit of finasteride in the system, not to counteract the Roaccutane, but to protect you, because clearly what we're seeing here is initiation of the balding process that we would have started the finasteride anyway.
Sure. So do you have a rough idea on the age sort of bracket in which you're happy to start that?
Yeah, typically I'm happy with patients from 16 years of age onwards.
Yeah.
Because usually at 16 they've completed puberty, so having a variation in the amount of testosterone versus dihydrotestosterone in the system is not going to be harmful to their sexual maturity.
And I think that's important to have that conversation, because a lot of people are at a very early age are quite sort of anxious and worried.
But there are people that have precocious puberty. So I've seen patients who come in at 13 or 14 looking like they're 16. They have the facial hair, they have all of the body hair, they have all the characteristics of somebody who's a 16-year-old. So I think there's a little bit of judgment in some of those patients.
Yes.
Where you can say they have had precocious, meaning early puberty, and they've developed faster. But typically, my go-to time is 16.
Right. And apart from the finasteride, anything else that you would use?
Well, obviously, if they were starting to show real signs of early androgenic hair loss, then we would recommend minoxidil for them as well.
Yeah.
And whether they use it orally, whether they use it topically, comes down to individual preference and what they're prepared to do. But I think that we should support them. They need a lot of psychological support. You need to be and so do their parents, because the parents are often just as worried about it, if not more, than the individual. And so I think I like it when they bring a relative in, so that I can make sure the message to both of them comes from the same source and they're hearing it at the same time.
Yeah.
And two sets of ears are better than one, because it's been proven any number of times that it doesn't matter how much information we give in a consultation, only some of it is picked up by the patient.
And they only hear what they want to hear. But I think it's really, I mean, you hit the nail on the head there, which is that in those scenarios, the consultation process is absolutely critical in getting that.
You need to spend the time to give the explanation, because people are much more compliant when they understand why they're doing something.
Yes.
If you just tell them how to do it, it's very all over the place.
Yes.
But if you tell them why they should do it, and they actually understand the motivation behind what you've recommended to them and the consequences, they're much more likely to be compliant.
So I think the key message there is that yes, young teenagers, or certainly individuals who can suffer from acne, Roaccutane is a great medical form of therapy, and certainly over time, over the last 20 years, we've been able, we're reducing the dose of that and finding what that sweet spot is. But there are some individuals where it can aggravate shedding, and it can cause shedding, and that can aggravate genetic types of hair loss. And in those individuals, we can be of use in trying to modulate that and trying to prevent that from getting any worse. Just whilst they're on that, it may be just whilst they're on that Roaccutane, and after that they may not need that support anymore.
That's true. I mean, obviously this is where we want to track these people over time, and I like, particularly my young patients, I like to see them every 6 months.
Yes.
As much for reassurance as anything else, because even though things don't change necessarily very rapidly, they need to hear it, they need to see it, they need to understand, and to keep them motivated.
And hair transplants are not the option.
No.
Yeah, so just let's be very clear on that. It's if you're suffering from hair loss during that period of time, a hair transplant is not the answer.
Pretty much the couple of times I've operated on people under the age of 20 have not turned out well.
Right. Yes. Anyway,
I mean, technically yes, but psychologically no.
No, it's caused more problems further down the track.
Well, they change their motivation, and then they wonder why they started. Right? It's a lifetime thing.
Commitment, yeah. Good. Well, I hope that answers that question about Roaccutane and its effect on hair loss. Again, thank you everyone for watching. We really appreciate that. Please remember to like and subscribe to the channel, and we'll see you on the next episode.
Thanks, everyone.
Take care.